Good morning, students. Today we're going to have our lecture on public school food policy and challenges. Today, our topic is going to focus on everything that has been a continuation from our lecture of childhood obesity and also everything that you saw in the documentary, The Weight of the Nation, Children in Crisis. Today's topic is going to focus on the latter half of the documentary, The Weight of the Nation, Children in Crisis, and how public school food policy, school lunch programs, and everything that's related to a school food environment really contributes to the childhood obesity within the United States. So let's go ahead and get started. For today's lecture, I think the most important term that we're going to talk about is this one right here that is known as competitive food. And what we really need to look at is the availability of competitive foods. Competitive foods are the best way to define them. They're food items that are usually of minimal nutritional value, and some of the common examples that I can give you are those that are high in sugar, fat, salt content, those that are high in trans fat content, so your French fries, a chocolate milk. Those are some prime examples of competitive food items that are usually available in school lunch programs. Now, in order to really help you understand in today's lecture, I have compiled a group of studies that were done on these topics and how we can utilize those results for future recommendations and for future research areas as well. Competitive foods, in order to define it a little bit further, these food items also compete for student dollars in the cafeteria with the healthier food items that are sold through the school lunch program. So in a way, if you have a competitive food, as the name and the definition says, it will compete for that amount of money that the student is possibly going to spend otherwise on a healthier food item. And because of the presence of a competitive food in the school lunch menu, the student is less likely to spend money on a healthier food choice. Now, there was a study that was done from the time of 2002 to 2006. It was a national study known by the name of School Health Policies and Program Study, SHPPS, and it was basically a study that looked at competitive food offerings in different school campuses, elementary schools, middle schools, high schools, a la carte items, and found out how is it that it compares in between each school campuses, and furthermore, what can we find out from those school lunch menus. So first of all, what they found out was that 33% of elementary schools had competitive foods of some choice or some combination. 71% of the middle schools had competitive food options. About 89% of high schools had competitive food choices. If you notice right here, there's a very clear trend. As the students are growing older and transitioning from one campus to another, the availability of competitive food choices is also increasing. And this is in all forms. It could be through a vending machine, it could be through a a la carte lunch line, it could be through a snack bar, a school canteen, a school store. So we're looking at several different options and how altogether they make up these numbers. If you also notice right here, we're almost at 90% of high schools that have some form of competitive foods, and thus we also see the highest rise of childhood obesity within this age group. So there are some very clear correlations for you to see here, and it helps you understand why would childhood obesity be so high in a certain age group. It definitely has to do with the school food environments. Furthermore, the study actually made a very positive impact because after the results were shared on a national level, we saw a lot of good work that was done. The percentage, for example, the percentage of school districts stopped allowing vending machines from offering high-calorie, low-nutrition foods and beverages, and that percentage was actually about 4%, before pre-2002. And after the study was completed and the results were released, that percentage of 4 rose to 30%. So more and more schools started to prohibit bad foods on their campuses. And that's actually a good number because more school districts, it tells us that more school districts are taking action against what items are being placed in the vending machines. But again, it's nowhere near to actually make a dent on childhood obesity. It is definitely work in a positive direction, but we need to see a lot more of it in order to make sure that we're really able to tackle this chronic health issue. Now, another significant number was the amount of water that was sold on school campuses. If you notice, for every public school, we usually have the availability of water fountains, but there's not a huge amount of water bottles that are sold through either vending machine or the beverages or through the snack lines. And from the results of the study, what we saw is that number also increased, where individual units of water were being sold in a packed bottle. And it used to be, pre-2002, this number was about 30%, and it rose to almost 46%, which is again another huge increase and a great move in the positive direction. Quickly about how else could a student get exposure to, foods that are higher in fat, salt, and sugar content. So if we're looking at, high school campuses specifically, or even in middle schools for that purpose, and you're looking at, your baked goods sales, that could be for any student organization, it could be for any cause-related purpose, but those also have a direct correlation in contributing to childhood obesity. What we saw is many of the school districts restricted those bake sales, and the number actually went down from 38% to 25%, which was again really good. And in particular, high schools are notorious for selling, very high sugary beverages. After the results of the study were released, we saw that more than 3/4 of the high school that sold sodas and high sugar fruit drinks actually made a cap on the amount that were being ordered per month. So again, we went from having no cap to actually having a cap and having some kind of, some kind of threshold level being placed there. In addition to that, the last thing that I wanted to share from this particular study was that half of the high schools that allowed the students to buy foods and beverages from vending machines or school stores really started to encourage participation in the National School Lunch Program through promotional materials, through putting attractive signs out of the lunch line and things like that, so that would attract students to participating in healthier food choices. And as you see, we had all of this data from one particular study. So when you see studies that are being done longitudinally over several years, they definitely collect lots of good data that can utilize on making preventive health changes within our communities and our societies. Availability of competitive foods. So I wanted to look into a little bit deeper into this availability of competitive foods, and there was a really great study that was done by the name of School Nutrition and Dietary Assessment Study, SNDA Part 3. And what this particular study did was it validated and confirmed that schools' current lunch offerings did not fully support a healthy diet for children and adolescents. And how did they find that out? They looked at where exactly would those competitive foods be available, and the biggest culprit were the vending machines. So then they collected data on what percentage of vending machines are available on each school campuses, starting from elementary and then all the way up in high school. And the numbers are pretty shocking. Even at an elementary school level, about 17% of the schools have students that have access to vending machines. Then 82% of the middle schoolers, and then 97% of high schoolers. So this number is pretty close to 100%, or pretty much every high school campus in the United States has some form of vending machines that sells a competitive food that takes the student away from a healthier food choice. What does it show you? This study shows you that there is a direct correlation between access to competitive foods with availability of vending machines. If you have a vending machine, unfortunately the trend is to fill it up with unhealthier food choices, that's also known as competitive foods, and therefore we have this direct correlation with childhood obesity. The study also looked at the availability of a la carte items that were sold across 85% of school campuses, and altogether they make up this huge impact on the health of our children today. Now, unhealthy foods, which were much more common, these are some additional side notes that I would like to share from this particular study. One of those was that unhealthier foods were much more common in high schools than in elementary, and this also depicted by this huge percentage of 97% versus 17%. We also saw that unhealthy foods were more common in rural schools more often than the urban or suburban schools. And this, again, could be due to the lack of access to healthier food items and food choices that are not available in rural areas. What we did see, which was a little surprising, was that there were no differences that were recorded in lower income and higher income schools. So even regardless of the zip code that is associated with the school, we did not necessarily see that impacting the availability of competitive foods. Each school or each type of school had the same availability of competitive foods. Now, additional competitive items actually came, like I said again, from schools related fundraiser that focused on, food or beverage sales. A great example would be a bake sale. And the problem is that these fundraisers were selling or are selling competitive, unhealthy foods. I mean, it was being offered in about 37% of elementary schools and about 60% of middle and things like that. So what that tells us is that, fundraiser of bake sales and that kind of culture is very much more common in middle schools and high schools. And unfortunately, they don't necessarily sell fruits and vegetables or healthier beverages. It's all about cookies and brownies and things like that, which definitely contributes to this chronic illness. And overall, competitive foods that we've seen in school lunches that are being offered are unhealthy, they're low in nutrients, and they're energy dense. And that's why they stand to be such a huge problem for us in our progress. So the School Nutrition and the Dietary Assessment Part 3 study found that students consumed 150 more calories every day from competitive foods that is low in nutrients and energy dense. And again, we found this particular statistics from this study right here. And the reason that I really like this particular number is it breaks it down for every single student of if they were to participate in purchasing competitive foods, how many more calories are they easily getting access to or are they consuming? And it could be as simple as, just getting into the vending machine to get a chocolate milk or just to get a bag of chips. You're gaining that many more calories because you're consuming it through competitive foods. Now, there was an additional study that was conducted on middle school students who had just transitioned from elementary schools and where the only food choices, of course, in elementary school, when we're looking at that, there are limited food choices in their school lunch program. So when they came from a system when there were, very little vending machines and a la carte items to a middle school campus, they moved up and they had all of those now available to them. Let's look at what happened to those students as far as the results of the study are concerned and the students' food choices. And these three facts right here have been carved out from that particular study. So schools a la carte availability, what we saw was the school's a la carte availability was inversely associated with the daily fruit and vegetable consumption. So for example, what that means is if the school had, the lunches or a pizza pocket or a bag of chips, different types, Gatorades, all of those available in a la carte line, it was inversely associated with the amounts of fruits and vegetables that will be consumed by the student. So if they participated in that line and purchased that and utilized their, daily pocket money on that, the a la carte items, then they're less likely to get into the school lunch line to purchase fruits and vegetables. We also saw that the daily total fat was positively associated with the competitive food intake. And like I said earlier, competitive foods are usually unhealthier foods or foods with little to no nutritional value and also very high in salt, sugar, and fat content. And saw was the daily total fat was positively associated with the competitive food intake. And this again gets validated through the study. The last fact that was proven through the study was the availability of snacks in vending machines that was negatively associated with fruit consumption specifically. So if the vending machines was filled with chips and cookies and, what other examples can I think of? Your cinnamon rolls and, sweetened foods, very high in sugar, very high in fat and salt. It was negatively associated with the amount of fruits that the students was going to consume that day at school. And that again tells us is why our students not getting access to healthier food choices, even though they're even though they're part of the school lunch program. What is the barrier that stops this access where the student gets into the lunch line, gets the healthier food choices, and eats it completely to then improve their health statuses? And now we're figuring out some of those barriers in between. We also saw that, students in general, when they participated in the competitive food lines, consumed lesser amounts of fruits, vegetables, milk. They consumed more sweetened beverages, even chocolate milk, or high-fat vegetables like French fries. In addition to that, the 2005 study, this study was again conducted in 2005, and it studied this correlation that was between students' body mass index and their school's food practice. What they found out was that every additional unhealthy food choice that was offered at school, the student's BMI went up by about 0.1. That's pretty significant, considering that it is the impact of one food choice as simple as allowing Rice Krispies. That tells us that even putting one simple food choice that could be really fun for students, I understand that, such as Rice Krispies, how could it negatively impact their overall health, especially when we're looking at masses of students all over America engaging in similar or even worse kind of practices. So then the question comes is that, the cafeterias, if you saw on the weight of the nation, children in crisis, that the cafeterias complained, in fact, not just the cafeterias, the school's administration, their reason for, putting all these competitive foods within the vending machines, within the school's lunch lines, is to increase cafeteria sustainability since their budgets are so limited and restricted. And therefore, there's this hesitation to enact strict policies that would prohibit competitive food options. The problem is that a lot of schools, administrations are afraid or unwilling to try newer options to really see if it actually works. And thus, there's this strict hesitation of not engaging in any kind of public health interventions to even see if there's a way that they can really, change the school's unhealthy food environment. In fact, we have evidence that reducing the amount of competitive foods from school's menu does not, in fact, hurt the school's revenue. And why is that? Because when competitive foods are limited, we see an automatic increase in participation in the school's lunch program. And therefore, it compensates for the loss of revenue that was going to occur in the snack sales of competitive foods. So if you limit the competitive foods by restricting it everywhere on your campus, of course, this only works if, it's the same policy throughout the campus, so you're not seeing, a soda vending machine in the girls' locker room or in the gym. It has to be consistent and the same throughout the school campus. But if you go ahead and engage and enact that policy, you will see an automatic increase in participation in the school's lunch program, the National School Lunch Program. And that's how you'll compensate for the loss of revenue that was going to occur through the snack sales. However, we do see hesitation in a lot of schools that even want to try that, unfortunately. We do have a few studies that assess the students' participation in the National School Lunch Program before and after a change of school lunch policies. And again, they saw that as they restricted the competitive food options, they saw an automatic enrollment increase in the school's lunch programs. Again, this is a focus area for further research, and it would be interesting to see how this particular study still holds true in 2018. Again, the data that I have is from 2008 to 2010, so it's a little bit dated, about 8 years ago, but it would be interesting to see if we can produce similar results from today's research on this topic. Now what I wanted to do is look at some federal policies on school nutrition. So one may say that, if the schools have so much leverage in putting whatever kind of food option they think would be profitable on the school's lunch menu, do we not have any kind of restrictions or dietary guidelines that propose what we should do or guide what we should do? And we definitely do. Actually, Congress and the U.S. Department of Agriculture have proposed these guidelines on school nutrition specifically, and these guidelines have been implemented on federally subsidized meals, which includes the school's National School Lunch Program and the school's breakfast program. So if any school is interested in getting a federal subsidy for their lunch program or their breakfast program, they have to abide by the USDA's dietary guidelines. The problem is that the foods and beverages that are sold outside of the meal program, so in the vending machines, in the school's a la carte lunch lines, or in the bake sales, they are all exempt from that rule. So that's a huge issue because, again, it kind of, even though the school's lunch program are abiding by it, not everything else that's offered on campus or in the cafeteria is. So you see this lack of consistency, and the student will automatically attract to the food choice that's a little bit more attractive to them, a little bit more high in salt, fat, and sugar, and it doesn't necessarily seem as attractive. So unfortunately, that's why we don't see the system balancing out and working. Now, another issue is that the federal requirements for competitive foods, we also had those that were proposed by the USDA, but they were established in 1979, so they're very dated. They definitely need to be revamped, and they were only applicable at that time to foods that were sold inside the cafeteria during meal times. So again, there's a lack of this consistency. What about that soda vending machine that is operating in the gym or in the locker room or in the bathroom or in the teacher or student's lounge. There are several places that those items are placed in to increase accessibility, and it would not apply to those items just because it's not being sold outside of the cafeteria. Now, some good work has been done, as you saw in The Weight of the Nation, Children in Crisis, that in 2007, Institute of Medicine gave their very healthy recommendations for competitive foods. And the recommendations are as follows. They talked about, federally reimbursable school nutrition programs, how they should be the main source of nutrition at schools, which means boycotting or completely restricting vending machines, or if they're placed in the school's cafeterias and other locations at school, they should be filled with only healthier food choices. And again, you're doing all of that because you want to restrict the opportunities to obtain competitive foods. Those opportunities should be limited, and that's the only way it will work. So it has to be a combined school effort of the school's administration, of the cafeteria staff, and of the state and the federal government. It will only work if it becomes a combined effort. They also further elaborated that if competitive foods are available, it should be limited to fruits, vegetables, whole grains, non-fat milk, and dairy products. Now, much needed. In today's standards, there are much needed recommendations because they're very strict, they're very hard, and they are doing something really good. They're trying to eradicate all the barriers that are in our system that prevent the students from engaging in healthier food choices, and they're taking it all out. And unfortunately, because it's such a big move, there's only one state that has adapted this recommendation, and that is the state of West Virginia. It is also the state that has the highest rate of childhood obesity. So when we talk about rankings in childhood obesity, West Virginia has the highest number. It's a good thing that they have adapted it, and that has definitely worked to decrease the number of childhood obesity in their state. But within Texas, we could also utilize or implement these recommendations, and that would definitely do us a lot of good as well. Now, in 2004, Congress also passed the Child Nutrition and the WIC Reauthorization Act of 2004 that required that all school districts develop a wellness policy, which would be a combination of healthy meals and physical activity. So you'll get, the goal was that it would require all school districts to develop a wellness policy that would include goals for nutrition education and nutrition guidelines for all foods that are available at that school. And based on through that nutrition education and guidelines, the students will be able to exercise healthier choices. This initiative, I believe, has definitely the potential to improve the school food environments. However, unfortunately, with every public health initiative, the problem is budgeting. We do not have the budget to create customized nutrition education and guidelines program for each school based on their menu. So a lot of times these programs remain in the theory. They have been practiced at several schools and have produce good results. However, it's not very widely practiced, and that's why I say it has great potential to improve the school food environments if it gets the budgeting needed. I also wanted to look at some of the state's policy as far as school food nutrition is concerned. So state agencies can impose restrictions on the sale of all foods and beverages that are sold at schools participating in the federal school meal program, so your National School Lunch Program, your school breakfast program. And what we saw since 2004, state legislative activity in the area of school nutrition has been brisk due to the concern about childhood obesity, and that's good. About half of the states, including 27, they have adopted competitive food policies that are more restrictive than the USDA regulations, and although the restrictions differ greatly in the type and extent. So in a way, what we're looking at, everyone is aware of the issue. Everyone is doing something about it. What we do see is the variation in the action or in the type of action that each state is choosing to take. Half of them have adapted their own policies that are more competitive than the USDA regulations. And remember, I told you in the previous slides, USDA's policies on competitive foods were created in the 70s, so they're very dated and definitely need to be revamped. So it's good that schools are looking in that direction and practicing that. Furthermore, we see about 11 states that have taken legislative actions to require higher nutritional standards for school meals than the minimum USDA requirements, and about 16 states have set nutrition standards for foods that are sold outside the school meal programs and on campuses. So Over here we see, the greatest intensity of actions against childhood obesity, specifically against competitive food sales, where they're not just targeting foods that are sold within the cafeteria, but also sold outside the school meal programs and on other locations on the campus. So they're, again, trying to be very consistent with their school's effort on combating childhood obesity and restricting those unhealthier food choices. And we do see the greatest effectiveness in those programs and the best results when the effort is consistent throughout the school campus. In 2007, the Center for Science and the Public Health did actually a study to evaluate the nutrition policies of schools from all 50 states. And the study focused on foods and beverages that were sold outside of the school meal. So again, it's completely or exclusively targeting outside of the school meal programs food items that are sold outside of it. And the report found that while many states had strengthened their school nutrition policies, the changes were, positive, but the problem was that they were fragmented. The study concluded that the nation actually had a patchwork of policies addressing the nutritional quality of school foods and beverages, and that nearly 2/3 of the states actually had really weak or about, no policies equivalent to that. And there were so many different state standards specifying differing amounts of fat and sugars, calories, and portion sizes. And the problem is, because it's so fragmented, because it's a patchwork of policies, it is not effective enough to bring a change in competitive food policies on school campuses. And food companies want this exact variability and policy so they can place the show and excuse for not doing anything. What we do need is one uniform policy, a national policy to establish nutrition standards for foods and beverages in schools. So again, some recommendations from this is that even though each state is doing good work and they're moving in a positive direction, why is it that it's not bringing about this national change throughout? And it's because this patchwork of policies that are addressing the issue of nutrition in schools at a different level in each school. If we had the one uniform national policy addressing the standards rigorously and a little bit more stricter throughout the country, we would definitely have the volumes and the masses and the dollars to go up to the food companies and say they have to do something about it. They have to customize and cater to our needs because we are bringing that kind of business. School foods or school menus are bringing that kind of businesses to those food companies. And then they'll definitely have to make a change and make it healthier. This concludes our lecture for today. Remember to read the following content that is posted for next module on physical activity, sports, participation in schools. There is a journal article that is also posted for next week and a handout. Okay, so I wanted to do a quick navigation video on this week's module as well. As you see, this right here tells you what's exactly going on in this module, Module 7 for Week 3. And we're starting with introduction with our goals and objectives, and following with accompanying lecture slides on school food policies. They've already been posted, as the beginning of the course, and I've told you guys about this in my previous lectures as well. I do little updates as far as dates are concerned, and then I repost the updated content on D2L. So that will be posted shortly, just with a little update right here on the submodules and the week number. Following that, we have an article on schools and obesity prevention, creating school environments and policies to promote healthy eating and physical activity. So this is a great article that talks about that school food environment and the policy challenges and how we can really utilize that to promote healthy eating, to promote physical activity, and an overall healthy student behavior on school campuses. It's a great read, and I expect you to know the content from this article the same way, for example, the discussions section, what exactly is the future direction for research and things like that. After that, we have a report on schools' meal challenges and opportunities. Although it says optional, again, it's a great read because it gives you a head start on our content for the next module, which is focused on the National School Lunch Programs. And this particular report is from Action for Healthy Kids. It focuses on the challenges that are faced within implementing a healthier national school lunch program. Some of those challenges are, complexity, commodity foods, costs, facilities and human resources. So again, it will really familiarize you with the overall problems that we face with the National School Lunch Program and also give you a head start for our next module for tomorrow. Then we have our conclusion and our checklist. So this sums up our module for today.